The Senate has yet to formally take up President Trump's big, beautiful bill, as it's called, but it will soon. It narrowly passed the House a week and a half ago, intent on cutting government spending. And that includes gashing Medicaid to the tune of nearly $1 trillion over the next 10 years. Joining us now to talk about the impact this could have on a smaller healthcare system and the people it serves is Mike Backus. He's the CEO of Oswego Health. Mike, good to see you. Thanks for being here.
Thanks for having me, Jeff.
Before we even get into any of that, let's kind of take a look at the financial standpoint right now for your system, because my guess is it's relatively thin.
Yeah, no, I appreciate it, and I appreciate you having me on this topic. You know, Oswego Health is an independent sole community hospital. You know, we're proud. We do stand on our own 2 feet largely, and, you know, it's not part of another system. There's nobody really there to bail us out, so to speak. So just like any other business or your home checking account, we've got to make it work. Those numbers are tight. Last year, we were very happy to get right back to almost a break-even number. We were right there on the edge of it. So we're doing well, but sadly, those small razor-thin margins, you know, they don't cover or allow us to do certain things, and that really is an impact. And when we talk about federal cuts potentially, that's when I get really concerned.
Yeah, well, let's go ahead and talk about those, because that could obviously be big for you. What would the proposed federal cuts do to Oswego Health?
Yeah, and certainly we're still studying this, of course, but, you know, anytime you've got service lines that are really struggling or right on those margins, even though they aren't necessarily essential in your community, you've got to have to look at them with really, really hard looks and to say, all right, what can we do more with? What can we do perhaps differently? What might it do? What might we need to change internally? And some of those nice to have, sadly, are things that just are not covered. And so we may have to make some adjustments to that. And, you know, one of the examples that I've used consistently when I've been lobbying in D.C., you know, our labor and delivery floor, maternity. You read any healthcare, read any healthcare magazine across the entire country right now, and you can see hospitals that are closing down those units. You know, we do 450 or so births at Oswego Hospital every year. We're very proud of our labor and delivery team. They really are essential caregivers. But we would have to look very closely, because sadly, that's a service line that no hospital really makes a lot of money on. So, you know, those impacts are going to be things that we have to figure out ways to cover. We know they're essential core services for our community, and we want to make sure we continue to offer them.
Yeah, I mean, obviously, we've talked about the impacts on your health system and kind of what you're going to have to do, but ultimately, how does that impact the people you serve?
Yeah, and, you know, in a community like ours where you have such a high needs of care, you know, diabetes is such a huge challenge in Oswego County. You know, we really work hard to make sure we're educating folks on healthy behaviors, healthy lifestyles. We try to make sure that we're seeing those patients, and sadly, the longer patients go without seeing care, the sicker they often become. And then we see folks have to come to us when their health isn't as good. And at the end of the day, that delayed care actually does end up costing more. So if we can do more preventative work, if we can do more primary care work, which I'm very, very proud of the work we do at Oswego Health. We have a robust primary care division. Psychiatry is another great example. Anytime we can get folks talking about mental health challenges that exist out there today, those are really, really important conversations. The more we can drive that, the better off we're all going to be. Sadly, if health systems like mine have to look at reducing that coverage, it's going to become impactful in our communities.
Yeah, and is that the real, like, hit, is that preventative stuff, so people aren't coming in sick or needing your help?
Yeah, you want to get ahead of it as best you possibly can to manage that care as early on in somebody's diagnosis as humanly possible. It's clear. That's what the literature says. You can get ahead of these challenges. But if you're not able to do that preventative work, if you're not able to have those conversations with patients early on, those issues just get worse. And that's when you start seeing more and more. That's when you see longer lengths of stay. That's when you see patients come to us in a more challenged environment. And that's really where you see the escalations in cost. So, you know, if you want to save money, you got to try to get ahead of some of these problems.
Right. Last one, and I only have about 45 seconds left, but I mean, some people may say, like, well, what can I do out there? What can people, is there anything they can do to try and stop these kinds of cuts?
Yeah, I wrote an editorial and I talked really about that deep need for our communities to stand up and talk about community medicine, talk about what we're doing in the community and your impacts on your local healthcare system. You know, we're very proud of Oswego to be an independent sole community hospital. We're one of the largest employers in Oswego County. We want to grow. We're working to be prepared for Micron. We need our community to be there for us, and they are so consistently. Now's the time to speak up and talk to your fellow representatives. Tell them how important local care is to all of you.
Make your voice heard. Mike Backus, you have today. Appreciate it, and I imagine we'll have to continue this conversation, but thank you for your time now.
I look forward to it. Thanks, Jeff.